So the next topic we will be covering is nutrition advice for a patient with obesity and hyperlipidemia. So definition: obesity is an abnormal or excessive fat accumulation that may impair health. And hyperlipidemia is an elevation of lipids, cholesterol or triglycerides in the blood. So what is the objective? First is to achieve and maintain an ideal body weight, reduce total cholesterol, LDL and triglycerides, increase HDL cholesterol, prevent complications such as coronary artery disease, stroke, fatty liver, diabetes, mellitus, promote healthy eating and active lifestyle. Okay, these are the objectives. Now coming to dietary principles: controlled energy intake, reduce total calories to create a negative energy balance, 500 to 750 kilocalories per day deficit for weight reduction. Okay, low total fat diet. Total fat 20 to 25% of calories only. Saturated fat should be less than 7% and trans fat as low as possible. Low cholesterol diet. Dietary cholesterol should be less than 200 mg per day. Avoid animal organ meats, egg yolk, full fat, dairy. Okay. High fiber diet of around 25 to 35 grams per day, soluble, insoluble both included, help in lowering LDL and body weight. Complex carbohydrates like prefer whole grains, millets, oats, brown rice. This we have been discussing since start in hypertension 2 and diabetes mellitus 2. Low glycemic index food. Adequate protein, that should be 15 to 20% of total calories. Prefer plant proteins and low fat milk. Meal pattern: have small frequent meals, 5 to 6 small meals per day. Avoid long gaps between the meals. Food preparation: use less oil, prefer steaming, boiling, grilling, roasting, and avoid deep frying. Okay, this we will advise. And also we can tell about reducing the portion size, avoid fried, fatty and high calorie foods. Prefer MUFA and PUFA oils as we discussed earlier too. Mustard, rice bran, groundnut, sunflower, soybean. Include nuts around 10 to 15 grams per day and seeds like flax seeds, chia seeds, sunflower seeds. Increase intake of fruits, vegetables and whole grains. Prefer low fat milk and milk products. Increase water intake around 2 to 3 liters per day. Avoid sugar, sugary drinks and alcohol. Take plenty of fiber and antioxidants. Maintain food diary and monitor weight regularly. Okay. So what are the lipid goals? Talking about hyperlipidemia, so what is the ideal lipid goals that should be there? So total cholesterol should be less than 200 mg per deciliter. Low density LDL cholesterol should be less than 100, which is the bad cholesterol. It should be less than 100 mg per deciliter. The high density HDL cholesterol should be more than 40 in males and more than 50 in females. And triglycerides should be less than 150 mg per deciliter. So this should be our lipid goals. Again, there is a list of food to prefer and food to avoid. So cereals, millets, pulses, legumes, vegetables, fruits, milk and milk products, fats and oil, nuts and seeds, and water, green tea, lemon water, herb spices. These are the foods which are preferable. What to avoid? Again, high fat, sugary food, fried and fast food, fatty meals and organ meats, egg yolk and high cholesterol foods, full fat dairy products, animal fats and hydrogenated fats, sugary drink and alcohol, excess salt and processed food. These are to be avoided. Then there is an example of sample meal plan. Lifestyle advice is again the same. Maintain an ideal body weight. BMI should be in the range of 18.5 to 22.9. Exercise regularly, more than 150 minutes per week. Avoid sedentary lifestyle. Stop smoking. Avoid alcohol. Manage stress. Yoga, meditation, other mindful activities can be done. Sleep adequately for at least 7 to 8 hours per day, and regular health checkup of blood pressure, lipid profile, blood sugar, etc. Okay. Ideal lipid profile. It includes the lipid goals we discussed, and VLDL is also mentioned, that is 5 to 40 mg per deciliter. Okay, so ideal lipid profile after you include dietary changes, lifestyle changes should be this. Okay. This is the summary of whatever we discussed. This is the plate method. What is the healthy plate? Half plate with vegetables, which is non-starchy. 1/4 plate with whole grains and cereals, and 1/4 plate with pulses, lean protein, like that. So this was all about nutrition advice for a patient with obesity and hyperlipidemia. Thank you.